common refrain I hear stroke survivors say is people saying, "Oh, you look great, and they're so relieved that you look great.
Yeah.
But that can be, a double-edged sword for a stroke survivor because they don't feel great.
Hello and welcome back to the Stroke Matters podcast. This series is brought to you by the Stroke Link Nurse Service in the Mater Hospital. I'm Melissa Gannon.
And I'm Lauren McDunphy.
With over 40 years nursing experience combined and currently working as Stroke Link nurses in the Mater Hospital Dublin, we have a strong passion for stroke prevention.
On today's podcast, we'll be chatting with the Mater Hospital's clinical specialist occupational therapist in stroke, Libby Cunningham. We will be chatting about post-stroke fatigue. We will give you some tips and advice on how to manage your fatigue at home. This podcast is for educational and entertainment purposes and does not contain personalised medical content or advice. Always speak to your GP or primary medical team regarding your own personalised advice and healthcare plan.
So Libby, myself and Lauren are very happy to have you here today, and you're most welcome, and thank you for joining us on the Stroke Matters podcast. Perhaps you could start out by maybe telling us a little bit about yourself and your own experience as a clinical specialist occupational therapist in stroke, and maybe what inspired you to become a stroke occupational therapist.
Okay, well, many thanks for inviting me to be on the podcast today. I'm delighted to be here to talk through some of the strategies and management that can help when you're living with a very common stroke impairment, such as post-stroke fatigue. So I have been working as an occupational therapist for just under 25 years, and I can distinctly remember where I was when I decided it was the area of stroke that really made me driven and passionate. And it was a lecture where we were learning about this impairment called neglect or an inattention, and it's where the brain almost plays a trick on the person who's had a stroke, where they bias or pay more attention to one half of the world or one half of their body. And I guess the brain, we know it's the most complex thing in the known universe, and the fact that when someone's had a stroke, it can result in so many different impairments and have so many different effects that we just don't even know about, we take for granted. And being able to have the opportunity to work on those difficulties and work on helping the person make adaptable changes within their brain is just endlessly inspiring. And I can honestly say I've never had a boring day at work. I'm continuing to learn all the time, and it just keeps me very engaged and interested.
It's really good to be able to say that, Libby, especially as you said, after 25 years experience as an occupational therapist, to still be inspired like that every day is really something else. And just, I think, goes to show how passionate you are about your role. We're very lucky to have you here in the Mater. So today, Libby, we want to focus maybe a little bit on maybe one aspect of your role as an occupational therapist. And I know it's a big issue for a lot of our patients, Lauren, which is post-stroke fatigue. It's very common, and it's often referred to as a hidden symptom of stroke. Many people hear the word fatigue and think it's maybe a form of tiredness, which has its own ramifications, because a lot of our patients really struggle with that, because it's not that they're tired. Fatigue is something separate altogether. Can you tell us what fatigue is maybe, and how it is different to perhaps feeling tired?
Yeah, absolutely. It's a really important point, and the fact that you've raised that it's hidden is also so important. It can affect people in a number of different ways. I think we all have experienced, that's a universal experience of feeling tired. But post-stroke fatigue, while you can feel tired, tiredness, there's usually something obvious that's caused it. Maybe it's been an illness, we've had a poor night's sleep, we're just trying to do too much, and life is so busy these days. I think we all experience tiredness. But post-stroke fatigue can persist, and even if you've had a full night's sleep, you're having a lot of rest throughout the day, you can still feel this fatigue.
Yeah.
It can manifest in a lot of different ways as well. So commonly people can experience physical fatigue, and so even doing simple everyday tasks requires a lot more effort. and then that can bring on that experience of physical tiredness. You can also experience mental fatigue, and that mental tiredness after a stroke, it can be more difficult for you to concentrate, to maybe do two things at once, engage in a conversation while you're doing something else. That sometimes isn't possible, and having to engage in a conversation with somebody could be enough to really exhaust your mental and bring on a mental fatigue. Engaging and concentrating to listening to your healthcare provider during a therapy session can bring on fatigue. Sometimes when I work on the early supported discharge team, and it's something we have to often be very mindful of when we're scheduling appointments, that we're spacing them out so people aren't inundated.
And getting too fatigued in between their therapy sessions, yeah.
That's right, yeah. And the funny thing about fatigue is you can look like you did before you had your stroke. You may have had what would be regarded as a mild stroke or a minor stroke.
Yeah.
But it very much, you can still experience post-stroke fatigue. And then it can vary in itself. You can have a mild presentation. It can be very severe. So what we'd see sometimes is even getting out of bed and getting washed and dressed can be enough to absolutely floor somebody. For other people, it might be they have to be more mindful about scheduling visitors. I think everyone's really keen to see you when you come home from having a stroke. And I think it's really important that, and it could be a family member that takes on this role where you're almost a little bit of a gatekeeper, and to maybe consider keeping that circle of people small initially, so because it can be completely overwhelming. And that brings me to the other kind of aspect of fatigue that can be like an emotional or psychological fatigue. Everybody is so keen to be reassured themselves that you're okay and that you're doing okay, and then you can, because you physically can look the same, and maybe your speech hasn't been affected or you don't have an obvious limb weakness. A common refrain I hear stroke survivors say is people saying, "Oh, you look great, and they're so relieved that you look great.
Yeah.
But that can be, a double-edged sword for a stroke survivor, because they don't feel great. And they're feeling like, why am I feeling like this? And I think sometimes people can take it as a reflection of them as a person, that they're experiencing this. Like if someone has a slurred speech or a communication difficulty, it would be unusual for a stroke survivor to kind of blame themselves for that, whereas fatigue just seems to be this impairment that people seem to kind of have ownership over, and that's just not the case, and that's just not fair. It's very much an observable impairment after stroke that a lot of research is currently ongoing. We don't know, the researchers don't exactly know the cause, why some people have fatigue, some people don't. Roughly it's around 1 in 2 people will have strokes, will experience post-stroke fatigue.
I think certainly we would find that as well with our cohort of patients. Roughly, it's roughly about 50% of them. And, for some it might be mild fatigue that certainly improves over time. And then for others, it can be quite severe and debilitating, especially when they first get home from hospital. And I think you're right in the point that you made. If somebody doesn't have an obvious physical disability like a limb weakness or a slurred speech, it can be difficult, I think, sometimes because they may look normal, and therefore people around them, as you say, these visitors coming to see them, expect them to be normal and back to themselves. And it can be hard for the patient to deal with that mentally, because this fatigue can be so debilitating for them, but it's not something that their relatives or visitors can physically see.
I think it's so important to get that message out there that fatigue is so common after a stroke. And I think like that, when people say to a stroke survivor, "Oh, you look brilliant, you're obviously doing really good," whereas they're feeling the full internal effects. And they might not feel confident with sharing that to the person that they're speaking to. So I think spreading the awareness and, sharing the information that it is very common. And hopefully throughout this podcast, we'll be able to give some tips on how to manage it and how to support it. Libby, I was just wondering, is there a difference? There's many patients who may have a TIA, a transient ischemic attack, who have severe fatigue. But then there could be someone who has a much kind of severe stroke. Is there a difference on the probability of suffering from fatigue, whether you have a minor stroke or whether you have a much bigger stroke?
I think, again, this research is ongoing. There's still a lot we don't understand about post-stroke fatigue, and that is one of the anomalies, that you can have a really severe stroke that has very obvious impacts on paralysis down one half of your body, major changes to your communication, to your cognition, and maybe the fatigue is less apparent. It could also be the fact that if you have a significant stroke, that is going to restrict and limit your ability to complete activities of daily living. And so, there's no research supporting what I'm saying here, but it does tend to be the milder stroke patients, cohort of patients who experience fatigue, and maybe it is for that very reason, because they are going home, they are re-engaging in their pre-stroke activities and going about their daily lives, and because of that, it can be more obvious that you're experiencing the fatigue.
And I think certainly something that we would see a lot of, Lauren, when we're engaging with our patients after their stroke, and it's a really common question that we will get from them: how long does this fatigue last after stroke?
Yeah. So there is some research being done on that, and it almost looks like you can fit it into 4 different categories. So there'll be some people who initially experience post-stroke fatigue, and that it does improve, and they might experience it initially, and then it can go away. Then for roughly another quarter of people, it might be mild but persist for a long time, and it might be something that you have to learn to live and manage with. Then there's a cohort of patients that have more severe fatigue, that they tend to be older, they tend to be females, and they also coincidentally suffer from depression a lot as well. And I think talking about depression is really important as well, because fatigue is definitely a recognized symptom of experiencing depression. So it's important to, if you are feeling fatigued, but you think that there may also be a change to your mood, that's really important that you speak to your healthcare provider about that. If you have post-stroke fatigue, it doesn't necessarily mean that you will go on to experience a change to your mood.
Okay.
Libby, you touched there on post-stroke mood changes and depression, which can often be other hidden symptoms of a stroke. Can you maybe chat to us a little bit more about the psychological impact that fatigue has post-stroke?
Yeah, I think fatigue can have a huge psychological impact. It kind of goes back to what I was saying, almost like people can be in a position where they might blame themselves or doubt or think that it's a reflection on their motivation, or they might feel like they're being perceived as being lazy, and like that can have a huge psychological effect on someone who is trying really hard to come to terms with a major medical life event that has completely uprooted their world. I guess there's other psychological fatigue effects. So it is very common to feel overwhelmed, more easily. Things that might not have bothered you might be bothering you more. Irritability is something that's commonly experienced and reported. And also just feeling more sensitive, and that can be to your physical environment. So being able to be in a busy environment, going to a shopping centre might just be absolutely your idea of a nightmare after having a stroke. And you might be wondering why that is and what's wrong with me. But when you think about everything that your brain has to filter out and process in a busy shopping environment, all the artificial lighting, all the noises, the other people that you're having to navigate, the human traffic, it's all very overwhelming. So even from that very sensory point of view, you can have increased sensitivities.
That can be very frustrating, especially for patients or stroke survivors who have gone home who are physically doing very well, and they're expecting to go back to doing their normal hobbies or activities, whether it's going to a shopping centre and having a browse or a ramble around, but then all of a sudden coming down with this overwhelming sense of fatigue, but not really understanding or too sure what it is, and they don't know why they feel like that. It can be very frustrating.
Yeah.
Absolutely.
And there's also that emotional impact. So sometimes people experience a change to, they might be watching an ad on television. They wouldn't normally be maybe an emotional person, but they feel that things have much more of an impact on them. Meeting family members or friends for the first time after the stroke, it can all culminate in, very an outburst of emotions, and there's absolutely nothing wrong with that, and it can't be construed as being necessarily a sign of low mood. It's absolutely part of that adjusting to this very significant life event that's happened.
Yeah. Libby, do you have any recommendations or any tips that could help stroke survivors best manage or treat their fatigue?
Absolutely. I think this is where awareness is absolutely key, and educating the person on post-stroke fatigue, knowing that it is an actual effect of the stroke, can be really helpful. Even seeing a publication about post-stroke fatigue, whether that's from the StrokeLink website, there are some specific written resources that we would often give to stroke survivors. There's the Royal College of Occupational Therapists have an excellent one. The Stroke Association in the UK also have a great resource as well. And I think it's really important for people to have that, to read through it, and it actually validates everything that they've been experiencing, and knowing that it is actual, it's not in their head, it is an actual condition and effect of the stroke, and it's something that they can give to their family members and friends, and help educate the people around them as well, so that because I look the same doesn't mean that I am the same.
That's a really, really good idea, actually, sharing that information with people around you and helping them understand, because it can be difficult to explain, I'm fatigued, it's not just a tiredness.
They're really good resources for stroke survivors to be able to access, and I think that's it. It's just the number one thing is understanding what it is and recognizing that this is how I feel, and then being able to go to the next steps of sharing with your family, sharing that information and education so that the family understand that you're not just tired. It's
totally normal.
Totally normal, and it's after a stroke. It's part of your recovery.
Yeah.
So I would frequently ask the stroke survivors I work with, are you experiencing any fatigue or tiredness? And I think people can put different words on things as well. So it's just good to actually know that it has a word. And then the next step would be to then understand your presentation of fatigue. So I think even so far today, we've talked about how it can present in a number of different ways. So it's really important that you understand how your presentation is, and maybe what activities tend to maybe act as a trigger for your fatigue. So one idea is to start off with familiarizing yourself with fatigue, and we do that through recommending use of a fatigue diary, where you actually maybe 3 to 4 times throughout the day, in the morning time, mid-afternoon, evening time, night, put a rating on how tired you feel, where 10 might be the absolute, you cannot do anything else. Getting down to more ones would be what your energy levels were like prior to the stroke. And then jotting down maybe some of the events, the big events, not everything, but just some of the events that took place during the day. And the idea being that over time, it'll give you an idea of whether you like some people will be absolutely exhausted from engaging in a conversation with more than one person.
Yeah.
Someone else, it might be reading a book, reading their stroke link booklet could be enough to bring them on. For other people, it could be going for their daily walk. They are still striving to do that because they want to put the stroke behind them and feel that they have recovered. But it's important to really listen to your body and recognize that that might be a stretch too far. And that's where a fatigue diary is really helpful, because you'll be able to see yourself, the patterns. So once you understand that,
what's exacerbating it, I suppose.
Tracking what works and maybe what's just pushing you a little bit too far.
Exactly. Yeah. And so the other really important phase of managing fatigue is planning and pacing. So if you know what your activities really bring on the fatigue, you will know how to then to space those activities out. And recognizing that different activities have different demands. So some, it might be more of a physical demand. Others, it could be a sensory demand, like going to the shopping centre. We would always advise to maybe start with structuring the day into 3 sections, and don't over schedule anything. Maybe maximum of 1 thing into the morning, into the afternoon, and then into the evening time. And that could be having a visitor. It could be having your stroke link nurse or stroke therapists come and do a therapy session.
Okay.
Never try and go to the shops, attempt to make dinner, and have someone come and visit. It's just could be too much.
You had mentioned there about walking. Does exercise help with fatigue?
So what we'd always recommend is that you do go for a walk and that you do get out. There are so many advantages to doing that. It's also important to incorporate maybe the other strategies we were talking about, like planning and pacing. If you are going to do that, it may mean that you have to pull back on other responsibilities you might have in the household. So, maybe if you are living with someone, that they can do the shopping on that day, not do a walk, and try and do the shopping or make the dinner, just to space those activities out.
Yeah. Libby, are there any other factors that would influence fatigue recovery?
I guess there's a number of different things. It's how you respond to your recovery as well. I think as fatigue, you may see it improve over time, and the temptation is to maybe do too much too soon.
Yeah.
So I think that's where the monitoring is really important, because you can go back and see, well, gee, actually this was how I felt the next day after I'd put too much in. But keeping that diary is really good to also gauge your progress and see, actually 3 weeks ago, this is where I was at. And now, a month or 2 on, this is what I'm able to achieve now. It's also really important to remember that the amount of activity, it's really important to find the amount of activity that is going to work for you. And it is going to be trial and error. There is going to be days where you attempt to do too much, but then you will learn from that, because you will feel so fatigued maybe that night, and the next day it might have an impact on what you're actually able to do. But it's also really listening to your body and learning from it is really important. So I guess the aim is to gradually build up the amount of activity you're able to cope with and manage with. Factoring in rest breaks is really important. As a general rule of thumb, we do want to avoid people feeling that they need to have a sleep during the daytime.
Okay.
And because we know that can disrupt their sleeping pattern, and we want to avoid that. We know how important sleep and rest is for the brain when it's trying to recover from a stroke.
Libby, as an OT, if you had to summarise, what top tips would you give to somebody who has post-stroke fatigue?
Yeah, great question. I think it's just to reiterate, it's really important to recognise and be aware that it is a impairment that's very commonly occurring after a stroke. I'd encourage the stroke survivor who's living with fatigue to talk about it, to educate the people around them. And that's really to help managing expectations, because I think people can expect you to be able to do what you're able to do, before the stroke, and that just isn't going to be the case if you're living and contending with post-stroke fatigue. Monitoring it, and in that way you're almost empowering you to be the own manager of your energy levels, and really thinking about it in terms of before the stroke your energy levels might have been represented in a 2-litre water bottle, and now your energy levels are down to a 500 ml water bottle. So your energy levels will deplete quicker. It's important to factor in rest periods to enable those energy levels to come back up. And also really important to reach out for support. And that's where a lot of the different stroke support groups that are out there, particularly the Irish Heart Foundation, have a number of different great stroke support services. And I'd encourage anybody living with fatigue to reach out to the Connect service and avail of any local stroke support groups, because I think talking to your peers, talking to people who actually have the lived experience is giving you something that no healthcare provider or family member or friend who isn't going, is giving you something that those people who aren't experiencing what you're experiencing.
Yeah, I think that's really important, is to reach out to those support groups, because it's so important to know that you're not alone.
Yeah.
There are many other people that are also suffering from post-stroke fatigue, and support groups are a great opportunity for you to learn like other ideas and tips that other people may have that have worked for them. But I think the take home is that you're not alone.
Definitely. And if I can just add one last thing as well, is just to really prioritize what you want to spend your energy. If you consider your energy being like a finite resource, and to really factor in enjoyable activities and things that make your life feel wonderful and meaningful. And it's not just all about getting through doing the routine daily things. Just ensure that you're factoring in time and energy to do the things that actually make life worth living.
That's great, Libby, thanks. And lastly, we like to finish up asking all our guests the same question, which is, what advice would you give to a stroke survivor or a family member who is supporting someone who has had a stroke?
Yeah, it's a great question. I think you can't go too far wrong if you meet the person who's had a stroke with where they are at that particular moment in time. I think everybody's stroke recovery journey is individual, and it's important that while we might be coming from the best place, we can't assume what we think is going to be helpful is actually helpful. So really asking the person living with stroke how best they feel they can be supported by you and helped by you.
Libby, we've loved having you here with us today, and all of your advice and information has been extremely insightful. I know many stroke survivors, their families and many others will find this really helpful. So many thanks for your time today. I know you're extremely busy, and we do really appreciate you taking time out to discuss such an important topic.
We know how much our patients have benefited from your input and the care and education, information and advice that you've given them. So this is, it's great that you're able to share that with many, many more, and no doubt you've helped many people today.
And we really appreciate it. Yeah.
Oh, thanks so much, guys. It's been a pleasure to be here. Thank you.
Thank you.
Thanks.
This podcast was brought to you by Stroke Drink. I'm Lauren McDunphy.
And I'm Melissa Gannon.
Make sure to follow our podcast series on Spotify, Apple Podcasts, or wherever you download your podcasts to learn about living well after a stroke.
If you like this podcast, please like and share it with family and friends. You can learn more on our dedicated website, strokelink.ie, where you will find an array of information and content written by stroke healthcare professionals, along with information on community supports and services. And always remember, stroke matters and you matter. See you next time.
Stroke Drink podcast was brought to you through the support at the Mater Hospital.